medicines save millions of lives every single day. But here's the truth. When some drugs are taken together, they don't just cancel each other out. They can actually turn dangerous. In the United States alone, thousands of people end up in the hospital each year because of harmful drug interactions. And many of these happen with medications that seem completely safe on their own. That's why in today's video, we're going to break down 10 of the most dangerous drug combinations you should never ignore. If you or someone you love takes prescription medicine, over-the-counter drugs, or even supplements, this video could protect you from a serious health risk. So, stay with me until the end, because I'll also share a few simple but powerful tips to keep yourself safe. Our first combination is antibiotics and birth control pills. Most people don't realize this, but certain antibiotics, especially a drug called rifampin, can lower the effectiveness of oral contraceptives. That means even if you're taking your birth control pill correctly, it may not fully protect you. Imagine a young woman prescribed antibiotics for acne or a urinary tract infection. She trusts her birth control to keep her safe, but the interaction puts her at risk of an unplanned pregnancy. Now, not all antibiotics cause this problem, but the point is clear. Never assume it's safe. Safety. Tip: if you're prescribed antibiotics while on birth control, ask your doctor or pharmacist whether you need a backup method, such as condoms, during your treatment. Our second dangerous combination is painkillers like ibuprofen, naproxen, or aspirin, taken together with blood thinners, such as warfarin. This mix dramatically increases the risk of internal bleeding. And the tricky part is, internal bleeding often isn't obvious until it becomes an emergency. Picture this. An older adult takes a daily blood thinner to prevent clots. One day, they add over-the-counter ibuprofen for back pain. It seems harmless, but the risk of stomach bleeding or even a brain bleed goes up significantly. Safety tip: if you're on blood thinners, avoid painkillers like ibuprofen unless your doctor approves. In many cases, acetaminophen, known as Tylenol, is the safer option. Our third dangerous combination is alcohol with antidepressants. Antidepressants, especially SSRIs and tricyclics, are meant to balance brain chemistry. But when alcohol is added, it can worsen depression, cause extreme drowsiness, slow reaction times, and even trigger dangerous heart rhythms. Think about a college student who takes an antidepressant daily. On the weekend, they binge drink at a party. Instead of just feeling drunk, the alcohol and medication together push the body into a risky state, making blackouts, accidents, or medical emergencies far more likely. Safety. Tip: if you're on antidepressants, the safest choice is to avoid alcohol completely. Even small amounts can have unpredictable and harmful effects. Our fourth interaction is statins combined with grapefruit juice. Statins are widely prescribed to lower cholesterol and protect the heart. But grapefruit juice blocks an important liver enzyme that normally helps break down these drugs. The result? Statin levels in the blood rise higher than expected. This can lead to severe side effects, muscle pain, liver damage, and in rare cases, a dangerous condition called rhabdomyolysis, where muscle tissue actually breaks down. Picture someone taking their daily statin pill in the morning, then enjoying a glass of grapefruit juice with breakfast. Over time, this simple habit can turn harmful. Safety. Tip: if you're on statins, stick to other juices like orange or apple. They're safe alternatives that won't interfere with your medication. Our fifth interaction is cough syrup combined with antidepressants. Many cough syrups contain an ingredient called dextromethorphan. On its own, it's generally safe. But when mixed with antidepressants, especially SSRIs like Prozac, Zoloft, or Lexapro, it can raise serotonin in the brain to dangerously high levels. This may trigger a condition called serotonin syndrome, which can cause sweating, rapid heartbeat, confusion, tremors, or even seizures. Imagine someone fighting off a cold. They grab an over-the-counter cough syrup without thinking, not realizing it could clash with their antidepressant and lead to an emergency. Safety. Tip: always read cough medicine labels carefully, and if you're on antidepressants, double-check with your pharmacist before buying any cold or flu remedies. Our sixth interaction is ACE inhibitors combined with potassium supplements. ACE inhibitors, like lisinopril or enalapril, are commonly prescribed for high blood pressure and heart failure. They already tend to raise potassium levels in the body. Adding potassium supplements, or even salt substitutes that contain potassium, can push those levels dangerously high. This condition, called hyperkalemia, may cause muscle weakness, irregular heartbeat, or in severe cases, cardiac arrest. Picture a patient who's told to take lisinopril for blood pressure. At the same time, they decide to boost their diet with potassium supplements for better health. Without realizing it, they're putting their heart at risk. Safety tip: never mix potassium supplements with ACE inhibitors unless your doctor specifically tells you to, and avoid using salt substitutes without medical advice. Our seventh interaction is blood pressure medications combined with decongestants. Decongestants, like pseudoephedrine or phenylephrine, are common in cold and flu medicines. They work by narrowing blood vessels in the nose to relieve congestion. But this also raises blood pressure throughout the body. For someone already on antihypertensives, such as beta blockers or ACE inhibitors, this clash can make blood pressure much harder to control and even trigger dangerous spikes. Imagine a person with hypertension who catches a cold and takes a popular decongestant. Instead of relief, they end up with a blood pressure crisis. Safety. Tip: if you have high blood pressure, avoid oral decongestants. Instead, use safer alternatives like saline sprays or non-decongestant cold remedies. Our eighth interaction is sleeping pills combined with antihistamines. Both of these medicines can cause strong drowsiness on their own. But when taken together, the sedative effects add up, making it difficult to stay awake, think clearly, or even breathe properly in some cases. Imagine someone who takes an antihistamine like Benadryl for allergies at night, and then adds a sleeping pill such as Ambien. The next morning, they may feel dangerously groggy, unable to drive safely, or even at risk of falls and accidents. Safety. Tip: never mix sleeping pills and antihistamines without clear medical guidance. If you struggle with sleep, talk to your doctor about safer, non-drug approaches first. Our ninth interaction is diabetes drugs combined with beta blockers. Beta blockers, like metoprolol or propranolol, are used to lower blood pressure and protect the heart. But they can also mask the warning signs of low blood sugar, things like shakiness, rapid heartbeat, or anxiety. For a person taking insulin or other diabetes medications, this makes hypoglycemia much harder to detect until it becomes severe. That delay could lead to confusion, fainting, or even a medical emergency. Imagine a diabetic patient on insulin who also takes a beta blocker. Their blood sugar drops, but they don't feel the usual early warnings, leaving them vulnerable. Safety. Tip: if you take both diabetes medicine and beta blockers, check your blood sugar regularly and always keep a quick source of glucose, like candy or glucose tablets, nearby. Our 10th and final interaction is opioids combined with benzodiazepines. Opioids, like oxycodone or morphine, are powerful painkillers. Benzodiazepines, such as Xanax or Valium, are prescribed for anxiety and sleep problems. Both of these drugs slow down the nervous system, especially breathing. When taken together, the sedative effects multiply, leading to extreme drowsiness, dangerously slow breathing, coma, or even death. In fact, this combination is one of the leading causes of accidental overdoses in the United States. Imagine a patient recovering from surgery prescribed opioids, while also taking benzodiazepines for anxiety. Without close monitoring, the outcome could be tragic. Safety tip: Never take opioids and benzodiazepines together unless your doctor has very carefully prescribed and is closely supervising both. And there you have it. 10 of the most dangerous drug interactions you should always keep in mind. Remember, medicines are powerful tools, but when combined the wrong way, they can cause more harm than good. Even over-the-counter drugs and supplements can interact with prescriptions in surprising ways. Important note: this video is for educational purposes only. It's not a substitute for professional medical advice. Always talk to your doctor or pharmacist before mixing any medications. If you found this video helpful, don't forget to hit the like button, share it with friends and family, and subscribe to SafeMed Guide for more clear, easy-to-understand health tips. Stay safe, stay informed, and I'll see you in the next video.